Today we'll study myocardial ischemia. Cause of the myocardial ischemia, its symptoms, changes in the heart tissue with reference to time and the related complications, how to diagnose MI, what are the changes in the ECG, and what are the parts of the heart involved with the corresponding changes in the ECG and the important MCQs. Let's come to the commonly artery occluded which cause the myocardial ischemia. Now, myocardial ischemia is a damage to the heart tissue as a result of blockage of blood supply to the corresponding tissue. The most commonly artery which is occluded is the left anterior descending artery, which supplies mostly the anterior region of the heart. Now, the second most common artery which is occluded is the right coronary artery, followed by the circumflex artery. Now, what are the symptoms? The symptoms are nausea, vomiting, retrosternal pain, pain in the left arm, neck, and the shortness of breath. Diaphoresis is the most commonly presenting symptom, and it means ठंडे पसीने आना. Now let's come to the time, changes and complications. एक बंदे को मायोकार्डियल इस्कीमिया हो गया है, उसके 1 से 3 दिन में क्या ऐसी माइक्रोस्कोपिक चेंजेस आएंगी और 1 से 3 दिन में कौन सी ऐसी कॉम्प्लिकेशंस हैं जो उस बंदे को हो सकती हैं. ऑन माइक्रोस्कोप 1 से 3 दिन के अंदर उसके हार्ट टिश्यू में न्यूट्रोफिल्स की अबंडेंस होगी. There will be contraction bands and there will be a typical picture of coagulative necrosis. Now in 1 to 3 days he can have arrhythmias, he can have a heart failure, he can have a ventricular failure, and most commonly he can have fibrinous pericarditis. Now in 3 to 14 days यानी कि 3 दिन से 2 हफ्ते के अंदर उसकी माइक्रोस्कोपिक चेंजेस जो होंगी, there can be abundance of macrophages along with the neutrophils and the granulation tissue. अब ये बहुत important है याद रखना because it comes in the exam that a person has died on the 8th day or 9th day of a myocardial ischemia. What can be the most possible cause? It can be the cardiac tamponade, because cardiac tamponade can lead to an imminent death. So in 3 to 14 days, the microscopic changes will be the macrophages along with the neutrophils and the granulation tissue. In 3 to 14 days, a person can have a free wall rupture leading to the cardiac tamponade. He can have a papillary muscle rupture leading to the mitral regurgitation, and he can have an interventricular septum rupture which can lead to interventricular shunt. Now, after 2 weeks, there is a contracted scar, and he can have the ventricular aneurysm, arrhythmias, heart failure, or Dressler syndrome. Now, Dressler syndrome is a condition in which, due to the damage to the heart tissue, it is exposed to the immune system and the immune system attacks the heart. And the picture is of pericarditis, pleuritic chest pain, shortness of breath, and other. Let's come to the diagnosis of myocardial ischemia. We should know that the enzyme which rises imminently and fastly just after the myocardial ischemia is myoglobin. But we do not check the myoglobin levels. We should only know that it is the earliest to rise. Now let's come to the CKMB and TROP-I. CKMB rises after 6 to 12 hours and its levels return after 48 hours. मतलब 6 घंटे के बाद ये राइज होना शुरू होता है और 2 दिन के अंदर अंदर इसके लेवल्स नॉर्मल पे आ जाते हैं, जबकि ट्रॉप-आई 4 घंटे के बाद राइज होना शुरू होता है और इसके लेवल 7 से 10 दिन तक वापस नॉर्मल पे नहीं आते, ये हाई रहता है. इसका मतलब है कि अगर एक बार एक बंदे को मायोकार्डियल इस्कीमिया हुआ है और 3 से 4 दिन के बाद उसको दोबारा हो गया है, तो ट्रॉप-आई के लेवल हमें नहीं बताएंगे कि इसको दोबारा हुआ है. क्यों? क्योंकि वो तो 7 से 10 दिन तक हाई रहेंगे. जबकि CKMB 2 दिन बाद नॉर्मल पे आ जाता है। तो अगर 2 दिन बाद उस बंदे को दोबारा इस्कीमिया होता है तो वी कैन चेक CKMB फॉर द री इन्फार्क्शन। These all are important, but we should know that in the first 6 hours, no enzyme tells us the best picture of the ischemia as the ECG tells us. So, ECG is the gold standard to diagnose MI in the first 6 hours. So, the most sensitive is trop T and the most specific is trop I. Sensitive means which rules out. So we can remember it as snout and spin. So sensitive is snout, which rules out, and specific is spin, which rules in. So trop T is snout, T snout, and trop I is spin, I spin. And the ECG changes in the myocardial ischemia are ST elevation, ST depression, T wave elevation, T wave inversion. ST ऊपर जा रहा है, ST नीचे आ रहा है, T वेव पीक हो रही है, ऊपर जा रही है, and T wave invert हो रही है, and there are pathological Q wave. You do not need to know कि पिक्चर कैसी है ECG की, you should only know कि क्या हो रहा है. ST elevation, ST depression, T wave elevation, T wave inversion, and pathological Q waves. Now we should know कि अगर V3 V4 में चेंजेस आई हैं तो विच पार्ट ऑफ द हार्ट इज डैमेज्ड. सिमिलरली V1 V2 में चेंजेस आई हैं तो विच पार्ट ऑफ द हार्ट इज डैमेज्ड. एंड अगर V5 V6 में चेंजेस आई हैं तो हार्ट का कौन सा टिश्यू डैमेज हुआ है. अब ये पिक्चर है लीड्स प्लेसमेंट की एंड हार्ट यहाँ पे पड़ा हुआ है. अब सिर्फ इन लीड्स को देखकर मैं एक रफ गैस लगा सकता हूँ कि अगर V1 और V2 में डैमेज हुआ है तो चेंजेस आई हैं V1 V2 में तो ये हिस्सा डैमेज हुआ होगा विच इज़ एंटीरियर एज वेल एज सेप्टल रीजन. एंड अगर V3 और V4 में चेंजेस आई हैं तो ये हिस्सा डैमेज हुआ होगा विच इज़ एंटीरियर एंड एपिकल एपेक्स. एंड अगर V5 और V6 में चेंजेस आई हैं तो ये लेटरल एंट्रोलेटरल हिस्सा डैमेज हुआ. लेट्स सी हाउ इट गोज. So, if there are changes in the V1 and V2, anteroseptal region is damaged. If there are changes in V1 and V2, anterior and septal region is damaged. Similarly, if there are changes in V3 and V4, so anteroapical, there are changes in V3 and V4, anteroapical region is involved. Similarly, if there are changes in V5 and V6, then anterolateral region is involved. V5 and V6, anterolateral region. Now we should know all the anterior region is supplied by the left anterior descending. So if there are changes in the V waves, V leads में changes हैं तो most commonly left anterior descending artery involved है. Okay. Now similarly, if there are changes in the lead 1 and AVL, L means lateral, so lateral region of the heart involved है. Okay. And if there are changes in 2, 3 AVF, F means foot, so inferior, and inferior region of the heart is supplied by the right coronary artery. Okay. Now let's come to the most commonly MCQs presenting in the part 1 exam. So the most common cause of infarction in the viscera means mesenteric ischemia. Most common reason is atheroma. Atheroma is the occlusion of the arteries due to the fatty deposition. Infarction is seen most commonly with the arterial occlusion. Now, as I explained, that if a male presents with a transmural infarct and died suddenly in the washroom after the 8 days of the myocardial ischemia, the most common cause can be the cardiac tamponade because it is the most lethal cause. बाकी भी changes आती हैं, like there can be the papillary muscle tissue damage, there can be the interventricular septum damage, but due to the cardiac tissue damage, cardiac tamponade can occur, and it is the most lethal complication of the myocardial ischemia. If a person has a non-lethal MI and dies on the first day, the most common cause can be arrhythmia. And if there is a cyanosis in the myocardial ischemia, it is due to the decreased cardiac output. So, let's just glance on this complications. In the less than 4 hours, complications are arrhythmias, most commonly arrhythmias, and cardiogenic shock or congestive heart failure. In the 4 to 24 hours, it's arrhythmias. And as I told, in the first 3 days, mainly neutrophils are present. Then, in the 3 to 14 days, these are the macrophages, and the changes and the complications can be mitral insufficiency due to the papillary muscles rupture, cardiac tamponade due to the ventricular wall rupture, or interventricular septum rupture, which can lead to the shunt between the ventricles. And then, after a month, there can be aneurysm or Dressler syndrome.